Hello and welcome. If you're a nursing student, you know there are some skills that are just non-negotiable. Today, we are going to master one of the most critical ones out there, administering oral medication. My goal here is to break this whole process down so you can do it safely, confidently, every single time. Let's jump right in.
So why does this one skill get its own masterclass? Well, it's all about this number, 40%. Just think about that for a second. Some studies show that you could be spending nearly half of your time on the floor, just administering medication. This isn't just another task on your to-do list. Oh no, it is a core responsibility, and getting it right is the absolute foundation of patient safety.
So here's our game plan for today. We're going to start with the why, the really critical safety principles. Then we'll walk through the whole thing, step by step. The prep work you do beforehand, what happens at the bedside, the super important follow-up, and finally, what to do when things don't go quite as planned. Think of this as your complete guide to a perfect med pass. All right, section 1, why this skill is so critical. To put it simply, this is the bedrock of patient safety. We're not just handing someone a pill and walking away. We're carrying out a high-stakes procedure where every single step matters, a lot.
And these are the absolute non-negotiable rules of the road, the rights of medication administration. Now, don't just see this as a list to memorize for an exam. This is your safety framework. It's your mental checklist that you're going to run through every single time. Right client, right medication, right dose, right route, right time, right documentation. You got to burn these into your brain.
Moving on to section 2. The preparation phase. A successful med pass actually starts way before you even walk into the patient's room. Getting your prep work down perfectly is everything.
I want you to think of this prep phase like a mission briefing. First, you pull up the medication administration record, the MAR. This is your single source of truth. You're checking the order, yes, but you're also checking for allergies, any contraindications, all of it. Then you gather all your supplies, your med cups, water, maybe a pill crusher. Being prepared is your first real defense against making a mistake.
And right here, this is your first of 3 crucial safety checks. As you're physically pulling that medication from the Pyxis or the med cart, you are comparing the label on the package directly against what's on the MAR. You check the name, the dose, the expiration date. This is your first safety gate. Nothing moves forward until this check is done.
And now it's time for the main event. Section 3, at the patient's bedside. This is the action phase. This is where all that careful preparation comes together, right there in front of your patient.
So before you even think about touching that medication, your focus is entirely on the patient. You perform hand hygiene, you introduce yourself, and then, this is so important, you identify your patient using at least 2 identifiers. That's usually their name and date of birth. Finally, you ask them directly, do you have any allergies? Even if you just checked the chart 5 minutes ago, you ask again. It's another layer of safety.
And here we go, safety check number 2. With the MAR pulled up and the medication in your hand, right there at the bedside, you do the comparison all over again. And this happens before you pop any pills out of their packaging. It's another crucial layer of protection, and it's all done right where the patient can see you.
Next up, you get the patient ready. Take a moment to explain what the medication is and what it's for. Then, you assess their ability to swallow. Can they handle a pill? And then, you get them positioned upright. We're talking sitting up at a 90-degree angle if possible. That's called high Fowler's position. This is so important for preventing aspiration.
And this is your final safety gate, the 3rd check. In most hospitals now, you'll use a barcode scanner. You scan the patient's wristband, beep. Then you scan the medication package, beep. The computer verifies that everything matches the MAR one last time. It's that final confirmation that tells you, yep, you've got the right med for the right patient at the right time.
Now, how you actually give the med depends on the type. For standard oral pills and liquids, they just swallow it with some water. Easy enough. But for buccal medications, you place it between their cheek and gum. And for sublingual, it goes under the tongue. For both of those, the key instruction is do not swallow or chew it. Let it dissolve. That's because it's absorbed right through the membranes in the mouth. Okay, so the patient has taken the medicine. Are we done? Nope, not even close. Let's get into section 4 after the dose is given, because what you do after is just as important as what you did before.
Before you even think about leaving that room, you have a few final safety actions. You absolutely must stay and watch the patient take the medication. You need to be sure they've safely swallowed it and they're not cheeking it. Once you've confirmed that, make sure the call light is right where they can reach it, and always, always lower the bed back to its lowest position.
Now, your job still isn't over. Later on, you're going to do an evaluation. You'll circle back to that patient's room to check on them. Did that pain medication actually help their pain? Did their blood pressure go down after the BP med? Are they having any side effects? This follow-up is how you know if what you did was actually effective and safe. And of course, the golden rule of nursing, if you didn't document it, it didn't happen. You need to immediately and accurately record everything on the MAR: the medication, the dose, the route, the time, all of it. You'll also chart the patient's response and any other assessments you did. This isn't just paperwork, it's the legal and clinical record of care. But, in the real world, things don't always go perfectly. So let's dive into our final section, handling unexpected outcomes. Knowing how to troubleshoot on the fly is what separates a good nurse from a great nurse. Let's look at 2 really common challenges. If your patient has a hard time swallowing, you can try putting the pill on the stronger side of their mouth and check to see if you can crush it, but never assume you can. Some meds can't be crushed. When in doubt, call the pharmacist. Now, for kids, it's a different story. Whenever possible, use a liquid form, and always, always use an oral syringe for an accurate dose. No kitchen spoons. Okay, what if a patient throws up after you give them a medication? This is so critical. Your instinct might be to just give them another dose. Don't do it. You do not automatically repeat the dose. Why? Because you have no way of knowing how much was actually absorbed. Plus, the vomiting itself could be an adverse reaction. Your job is to assess your patient, make them comfortable, and call the provider immediately for instructions. So let's just quickly contrast 2 very different emergencies. If a patient is actively choking on a pill, that is a life-threatening emergency. You jump into action immediately with your basic life support or BLS protocol for choking. But if a patient vomits, the response is different. You assess, you provide comfort, and then you notify the provider. Knowing which path to take is absolutely essential. So, we've walked through the whole process, right? From the prep work all the way to troubleshooting problems. But that brings us to the most important question of all. You've learned all the steps, but how do you turn this from a skill you have to think about into a true, confident instinct? Well, the answer is practice. It's repetition, and it's truly understanding the why behind every single step. When you master this fundamental skill, you're not just studying for a checkoff or a test. You are building the foundation you need to ace the NCLEX, and more importantly, to become that safe, competent, and confident nurse that your future patients are counting on. Hey, if this explainer helped you connect some of those dots, do me a favor and hit that like button, share it with a friend from your class, and definitely subscribe for more nursing skills masterclasses just like this one. And if you're in study mode, check out the links below. We've got some awesome summarized NCLEX revision books to help you nail it. Thanks so much for watching. Now go be great.